start my subject today regarding the vomiting with pregnancy, what we call it hyperemesis gravidarum. In this holy month, Ramadan, we find a big problem for us as a doctors to treat this disease. Why? What do we mean by vomiting in pregnancy or hyperemesis gravidarum? Means vomiting related to pregnancy. Why? Let me explain to you the effect of the pregnancy or hormones of pregnancy and how vomiting occurs. If we can imagine that, let me get this little book for you here, from here. If we can imagine here, that is a vagina, here is the neck of the womb, what we call it the cervix, and here is the womb, what we call it the uterus, and usually the baby is inside here. If your womb is not increasing in size, is not getting bigger, this baby, I mean the fetus inside here, will find his way outside and what we call it abortion or miscarriage. Then this womb or this uterus to relax, to accommodate the fetus inside, or what we call it the baby, and to allow the baby to grow, there is a placenta which gives a blood supply of the baby. This placenta, this is what we call it here, that is the placenta which gives a blood to the baby. This placenta secretes hormones, and this what we call it the hormones of pregnancy. Many, many hormones. There is no time to talk about it in this subject. But once this hormone, it goes, here is the placenta, if you can imagine, and here is the baby inside the womb. The hormones goes from the placenta to the maternal blood, I mean to the blood of the mother, straight, and it goes to the heart. And from the heart, it goes down to the womb, to the uterus, to relax it. But once the hormones of the pregnancy, which is secreted from the placenta, it goes to the maternal blood, to the blood of the mothers, it relaxes everywhere in the body because it is in the maternal blood. What we means, but it relaxes everywhere. It doesn't relax only the womb to allow the baby to grow, but it relaxes the stomach, and I will come to that later on, because when it relaxes the stomach, that is the cause of the vomiting, which I'm going to explain it later on. But also, it relaxes the blood vessels, which runs in your legs and in your arm, and it make all the smooth muscle of the body in relaxed status. Once the blood vessels is relaxing, this means it is dilated more, and once it is dilated more, the 5 liters of blood which is in your body, it goes to the lower limb. No blood reach the brain, and that is the reason why do you feel dizzy in pregnancy, or sometimes fainting attack, especially at summer. Let us go back to our main subject, which is vomiting with pregnancy. These hormones, which goes from the placenta to the maternal blood, to the heart, and from the heart to the womb to relax it. At that time, when it goes, it relaxes also the stomach. Once the stomach is relaxed, if you put any food on relaxed stomach, it contracts and expel it out, and that's what we call it vomiting. Let me go a little bit more. The stomach usually without any pregnancy evacuate when you take any food from the mouth. It goes to the esophagus, it goes to the stomach, and in the stomach it work like, mathana, but then it goes from the stomach to the intestine, okay? At that stage, all the food has been evacuated. Usually it is evacuated from the stomach to the small intestine in 4 to 6 hours time, okay? If we leave the stomach to be completely relaxed with the hormones of the pregnancy, this means when the stomach is completely empty, you put the food, it contracts, you get all the food outside. Then what is the treatment for that? Treatment is not medicine. It is very easy when you come to my clinic and you come and you are a pregnant lady and you're complaining of vomiting with pregnancy, especially on the first trimester and the first 3 months of the pregnancy. When I rule out all of the other causes which is not related to the pregnancy, and I tell you, please take that source of medicine which will relieve this vomiting or decrease it. That's wrong. Completely wrong. You know that we don't like any medicine on the first 3 months of pregnancy. Treatment is dieting, and that is the reason why I choose that subject for Ramadan holy month. Mainly dieting. What I mean by mainly dieting? As the stomach is getting more and more relaxed with the hormones of the pregnancy, I have to keep the stomach all the time in a stage of contractility, working all the time. Because if it is working all the time, when the food comes on the stomach, we will find the stomach is not contracting and expelling it outside. This means the treatment is dieting mainly. I don't mean by dieting reducing diet. No, by regulating your diet. You have to take the type of the food which is hard, solid, and less fluid to give the chance for the stomach to work, okay, for long time. And you have to eat every 4 hours, every between 3 and 4 hours all the day through. What do you mean by that? Usually we have our meal as breakfast, lunch, and supper. But at that time, if you complain from vomiting with pregnancy, because you may have the pregnancy and no vomiting at all, there is no need for any instructions. But sometimes when hyperemesis occur, vomiting with pregnancy, that is our advice. Between breakfast and lunch, you have to have one more diet. Between lunch and the supper, you have to one more diet. And between lunch and midnight, you have to have something more. Situation like that, you will find that you eat every 3 to 4 hours all the day through. Do you expect that I will give you an advice to have a meal at 12, after 12 midnight, to tell you every 3 hours go and have a meal to reduce the vomiting? Of course not. You should expect that I will allow you to go and to sleep all night, but your stomach will be relaxed all night because you will have no meal between 12 o'clock midnight to 6 or 7 o'clock in the morning. And you should expect that the first meal you are going, I mean the breakfast in the morning, you may vomit. You should accept that as normal. But after that, you have to try very hard taking a dry meal. What do you mean by dry meal, doctor? That is usually the questions. Biscuit, box nut, or any dry food, but be away from the spicy food. Situation like that, do you think that will allow you to fast, or the treatment is to regulate your diet? If you don't regulate your diet and the vomiting is just carrying on all the way through, the complication here is that the metabolism goes in different way. Rather than going on the normal way, it deviates to something called the Krebs cycle. And this Krebs cycle, you find in your urine the development of ketonuria, which you can discover it by yourself. By urine test, you can do it at home. If there is any ketonuria, ketones bodies in the urine, or acetone, you do that's a very simple test. You do it at home. If this ketonuria is there, you should go to your doctor quickly, because which will give you intravenous drip, trying to help you, to keep your urine clear from the ketonuria. Because if it carry on with dehydration, loss of fluid, loss of electrolytes, and the ketonuria, this will affect your health. We don't accept that. At that time, you have to see your doctor and you have to be admitted to the hospital for treatment, because we don't like to reach the stage of termination of pregnancy because of vomiting, which is very rare now with the new medicine and the new progress in medicine. For that reason, we say hyperemesis gravidarum in moderate and severe degree. I don't think you will be allowed to fast Ramadan until you feel better. Then after that, please go ahead and fast Ramadan. كل سنة وانتم طيبين.